gloves and grab it from you. So I'm only touching the back side. And you can tell on this, the back is plastic lined, so it's leak proof. The inside is more fabric. I'm going to lay it out. And I'm taking my hands away. It is sterile. So there's my sterile field. If I need to open my equipment, my doctor's sterile. I'm not going to cross over it. I'm going to open it. I'm going to let it drop. That's still sterile. As long as I don't touch it, it's still sterile. As long as my hands are away from it. Same thing. If he says, give me a syringe, I'm going to do the same thing. I'm going to open it, and don't touch it, and drop it. See how close it is to the edge? It's almost to the point that it's not sterile anymore because I'm that close to the edge. I want it preferably in the middle, because what part of this is not considered sterile?
The edges.
Like the 1-inch edge around is not considered sterile. So he's got his field open. He says, open me. We're doing a procedure, open a sterile procedure tray, a laceration kit. They have all kind of different names. This has everything I need to do it. It's got some gauze, it's got a sterile drape, forceps towels, sterile Q-tips or cotton tipped applicators, a medicine cup, some scissors, and a needle holder to do sutures. Everything he needs to do a procedure except the scalpel. So when I open this, it's sterile. So I would open this for him. He's in sterile gloves. He's going to reach in there and take the stuff out because he's sterile. He's going to take his sterile drape. He's going to take his sterile towel. All this is sterile. What are these cups for? He's going to lay them on his little sterile field, and he's going to ask you to do something with them. What do you think it's going to be? One is going to be peroxide, one is going to be betadine. He's going to use one to clean before and one to clean off after. So you have to take that non-sterile bottle and come over into the sterile field and put that liquid in it. How am I going to do that? Am I going to do this?
No.
You're going to kind of pour. Peroxide, you're going to pour. Your betadine kind of has that squeeze bottle. You kind of squeeze it in. You get pretty good with your aim after a while. It's going to go everywhere. It's okay. It's still sterile. So he says, I need you to help me. Put on some sterile gloves. Sterile gloves come in different sizes. Whatever size you wear in regular gloves, you probably wear the same size. These come in small, medium, and large. Some of them come in sizes like 5, 5.5, 6, 6.5. Whatever size your doctor wears is the size you're going to have in the office. So how do I put these on? There's a certain way you put these on. I'm going to open it. What part of this is sterile?
The inside.
The inside. So as long as I don't touch the inside, it's still sterile. So I'm going to open it. I should have practiced them before I did this because this is a different brand than I'm used to. Remember, the outside is not sterile. The inside of my gloves are. So I'm opening this. I'm not shaking it out. That's defeating its purpose. I'm trying to handle it as little as possible. Open, and you can see it tells me pull to open. So I'm going to grab underneath this edge. And I'm going to pull. And now my sterile gloves are exposed. They're left and right. The outside of them is sterile. So what part of these can I touch?
Inside.
The inside. I can touch the cup. I'm left-handed, so I put my left one on first all the time. I grab it by that cup. I put my hand in. Never touch the glove, the outside. So I'm in. How am I going to grab this one?
From the
Yep, I'm going underneath that cuff. Ooh, these are crappy gloves. I'm going underneath the cuff, not touching the inside. I'm going under the cuff, and I'm putting my hand in. I'm doing the same thing. Obviously, this is not the size I would wear. So I'm in sterile gloves. So I can touch anything in here now because I'm sterile. help him. I can hand him stuff. He can hand me stuff. I'm sterile. What if I do this?
Oh, you have to change it.
Yeah, I'm not sterile anymore. As soon as my hands leave this and go anywhere, I'm not sterile anymore. What if I'm standing at my sterile field and somebody knocks on the door? What happens? I'm not sterile anymore. Now my field is probably still sterile because the doctor's standing over it, but I'm not. So I need to take these gloves off and throw them away and get another pair. That's why I said I always bring extra pairs of everything and extra boxes of everything, because I don't want to have to go run out of the room and get stuff. So the inside is sterile. The inside is not sterile. The outside is. When you put your gloves on, once you get that glove on, just touch the outside. Same thing with the kit. If I was in sterile gloves, I could come in here and grab stuff. If I wasn't, the doctor has to do it. And you see he has everything he needs. He's got his sterile drape, just like that one. I'm sterile. I can touch either side. He would lay all his stuff out. Here's his sterile drape. And it's got a hole in the middle. What's that called? Who remembers?
It goes on. What is this used for?
I know that's whenever they're about to operate on something to cover you.
In that one spot.
That's for anal.
If I was having my eye done. Or if it was a spot on my arm, it would be like this.
Oh, okay.
So what's that drape with a hole in it called?
Does it start with a B?
Usually they have a sticky, you can take a piece of sticky tape, you peel it off and it'll stick. Usually it's not, that's why I keep looking at it to see if they have one, but they don't. Usually there's a piece of tape, so I can tape it onto whatever so it's not flopping around. Nobody knows what a drape with a hole in it is called? Yeah.
From something.
Don't tell us,
Not.
It was in one of the positions.
Uh-huh. It sure was.
Oh.
Now would I be refolding this after it's done? No, I'm throwing that whole thing away. I'm wrapping this whole thing back up in the package it came in, and I'm putting the whole thing in the sharps container. Everything that's sharp is going in the sharps, everything else is going in the red box. I'm getting rid of it. All this is sterile. My cotton tipped applicators, my gauze, my instruments, it's all sterile. Nobody got it yet?
It starts with a what?
Yeah.
F.
Don't tell us this.
I'm not. I told you I wasn't.
Fenestrated?
Yay!
What
yes.
is it?
Fenestrated.
Yeah.
Fenestrated drape. It's a drape that's got a hole cut in it. If there wasn't a hole in it, he would just be able to drape it where it's a lot easier when it's got the hole in it. And it's even easier when it's got tape attached to it. So anything in this pack, now, is this pack good to go to surgery?
No.
No, this is not sterile.